All right, Linz, thank you. As the coronavirus continues to spread, restaurants across the country are shutting their doors to dine-in customers. So many of us now are ordering to go just to try to keep those businesses afloat.
But in this time of social distancing and other precautions, is it safe to get takeout food? We're joined live this morning with Dr. Dana Hawkinson with the University of Kansas Health System to talk about that a little bit. Doctor, of course, Takeout Tuesday is what we're encouraging people to do to support those businesses, maybe get a chance to get outside. What do people need to do? Is that safe whenever I go and pick up food? Should I wipe down everything before I bring it in my house?
Yeah, I think there's various things to do. Again, it's all about, an overabundance of caution. So I've heard many different things. Some people are having it left on the doorstep or on the porch and they've paid online. Some people are taking it out of the bag and bringing it into their house. There's all these things you can do. You can certainly wipe down hard containers if you want. The food itself should be fairly safe. You can always dump the food out onto your own plates or your own bowls, do things of that nature. Just remember, probably the last thing you want to do before you eat is wash your hands. That way, your hands are clean. You can get a clean fork from your drawer or a clean spoon. But I think that's probably the safe things to do. Like I said, there are a lot of different variables and things that people do when they are getting takeout that I've heard. So just have an overabundance of caution. But the probably final step right before you want to eat is doing the hand washing.
That makes total sense. Dr. Hawkinson, kind of along that same line, this was the first time this week when we came home from the grocery store, we just decided to wipe down our baby's pouches that she holds and eats from. Is that overdoing it? I mean, what do you think about that?
No, again, I don't think that's overdoing it. I don't think it's OCD. I think it's being cautious. We know people can get infected by not having any specific contact with anyone that's sick. We know that the disease is in the community now. I think it's responsible. Again, it's an overabundance of caution. It's obviously not probably going to be any harm to your child, so I don't think that's a bad thing to do.
Well, Dr. Hawkinson,
very different times we're living in.
That's exactly right. Dr. Hawkinson, we know you're one of the busiest people in all of Kansas City. We appreciate you taking some time this morning early with us to kind of clear some fears out of the order for people and let them know what's safe and what's maybe not safe right now. We appreciate that time.
Yeah.